Today we see that so many young people are suffering from orthopedic problems. We all know that the elderly people have wear and tear of the joints, but even the young people are suffering from knee pain, back pain, neck pain, and very often, it is a significant number of patients who come to me in my clinic. They are suffering from all these things. Even at the age of, I've seen so many patients who are just say 20 years, 25 years, or something like that. And I think there are a couple of reasons which are important. As we always say in medicine, the prevention is better. So I think people who have not got back pain should, learn from some things, tips like this. I think the most important today's, reason for having this back pain and neck pain is our posture. We are all using laptops, we are all using computers, we are all using mobile phones, and we are manipulating our spines in all sorts of directions in bad ergonomical positions. If we sit, in a bad posture, there is a unit in the spine which we call the disc, intervertebral disc, which is a sort of flexible unit or a shock absorber or functional unit in the entire spine, which is getting compressed in very awkward direction, and this wears off. If you keep the same position for a long time, then there is a wear and tear of this disc. This disc, if we see, it is like a shock absorber. There is an outer layer called annulus, and the inner layer is in inner portion is like a pulp. So it is like a perfect hydraulic system. Now, if we abuse it, if we don't, have the posture which is perfect, then this the flexibility or the elasticity of this disc progressively goes on reducing. Things like smoking, they add hugely to the degeneration of the disc. And then this is also one of the important factors. The posture is important factor. The obesity today, the fast food culture which has come, especially in younger kids, and cola, and lot of cola. If we have soda, which is like if you take it, then that also causes osteoporosis. Alcoholism, that also is a problem. So your habits, the posture, and weight, I think these three are the major factors which are most important. If you prevent it, and one has to prevent it before they start it, that's the best treatment, I think. But if the patients they start getting it, I think we did a huge, big research on various methods to treat this back pain and neck pain, and in our hospital in Pune, Lokmanya Hospital, and we did a research that project was named as Zero Backache Through Yoga, and it helped immensely in patients who don't have neurological complications. Because in the early stage of arthritis of the spine, that is called as spondylosis or disc problem, patients who do not have pain which is going in the legs, patients who do not have any neurological deficit, these patients they do exceedingly well with this yoga and physiotherapy. Posture control, yoga, physiotherapy, diet control. So we run a course for this particular non-operative treatment of this through yoga. There is a separate department which helps these people. So in the primary stage, when it is just starting to increase, then these things definitely help. In the second stage, there are minimally invasive treatments for this backache and posture. We do a lot of percutaneous laser disc decompressions. We use endoscopic techniques to reduce the disc pressure. And if everything doesn't fail, only 4 to 5% of the patients require operation treatment, surgical treatment, like decompression, surgical discectomies or microdiscectomies or fusions of the spine. So there is it's always, I think I always tell the patients who are started to get back pain, everybody tells me, so many patients tell me that I don't have time for exercise. So I need to tell them that, okay, see, ultimately it's your body. We always give time to eat, we always give time to sleep. So we have to give time to our body, our spine. It's very, very important in the initial phase of back pain or neck pain, and just start doing about 20 minutes of yoga or back exercises, and that's going to be of immense help in preventing further damage of the spine and neck. So that is the story. So generally speaking, I think for most of the people, these things are going to be most useful.